Good morning! If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. Smoking cessation drugs. Over the last few years, many products and remedies have appeared on the market to help people stop smoking. One of the first-line pharmacological treatments for smoking cessation are antidepressant drugs. Among them, the most widely used is bupropion. Research into drugs capable of helping smokers to quit smoking was initially directed towards the exogenous replacement of nicotine, the substance responsible for the highly addictive power of tobacco. However, the partial success achieved with these forms of treatment made it necessary to look for new therapeutic avenues. To higher prevalence of depressive syndromes among smokers, the tendency to depression observed in up to 35% of people who quit smoking, and the finding that smokers with depressive symptoms have greater difficulty quitting than those who do not suffer from them, led to a search for the possible efficacy and usefulness of anxiolytic and antidepressant drugs in the treatment of smoking. In this regard, a drug initially used as an antidepressant, bupropion, has been shown to be effective against smoking. It is the first substance that it is not based on nicotine substitution to help quitting smoking. Through its action, it reduces withdrawal symptoms and curbs the desire to smoke. Several clinical trials have confirmed its efficacy and tolerability, with success rates in smoking cessation higher than those achieved by placebo or nicotine patches. Bupropion and phenbutamine reduces cravings, withdrawal symptoms and relapse rates in chronic smokers. This substance, administered at the same time as appropriate motivational support, is indicated to help people with nicotine dependence to quit smoking. It also reduces the weight gain associated with smoking cessation, both in the short and longer term. This is particularly interesting as weight gain is one of the main reasons for relapse. The indiscriminate use of bupropion without respecting contraindications or precautions for special situations requiring adjustments in dosage has led to the appearance of adverse effects, generating a sense of alarm in public opinion. The dose, which has achieved the best abstinence rates and lowest weight gain, is 300 mg daily, divided into two doses of 150 mg. However, treatment should start with a single daily dose of 150 mg, which should be maintained for the first 6 days. Until recently, it was recommended that this dose be maintained for only 3 days. It is now preferred to prolong it somewhat longer to increase the safety margin of the drug. This should be followed by the standard 100 mg twice daily, separated by at least 8 hours. Since the most common adverse effect is insomnia, in order to minimize the possible occurrence of insomnia, the evening tablet may be taken a few hours earlier. Bupropion should be started at least 1 week before the quit date, as at least that time is needed for the drug to reach stable plasma levels and to be fully effective. From the agreed quit date, preferably in the second week of treatment, smoking should be completely stopped. Treatment should be maintained for 7 to 9 weeks, although the optimal duration has not yet been defined. Medical assistance is highly recommended for the use of this drug. Combination therapy. To date, 2 studies have analyzed the efficacy of the combination of nicotine replacement therapy, NRT, and bupropion. The results show an increase in efficacy, although it is true that, in one of them, this increase is not significant compared to the results obtained with bupropion alone. It is noteworthy that both studies used nicotine patches as a form of NRT. It should also be noted that this combination may significantly increase the percentage of adverse effects, mainly arterial hypertension. Contraindications. It should be noted that it is well tolerated and that the adverse effects it causes are few and, in general, of little relevance when therapeutic contraindications are taken into account. It should not be used by anyone with a history of epilepsy or who is likely to suffer seizures due to a previous severe head injury or heart injury. Should be used with caution in smokers who drink large amounts of alcohol or have anorexia or bulimia. There is no evidence of harm during pregnancy and breastfeeding. Common side effects include difficulty sleeping, agitation or anxiety, dry mouth, and headache. Other medicines. Other medications such as nortriptyline and clonidine have been useful in some patients to help them quit smoking, but are not used as frequently as nicotine replacement treatments or bupropion. Varenicline Champix is a neurodrug developed specifically to help people quit smoking. It works by interfering with nicotine receptors in the brain, which has 2 effects. It reduces the physical pleasurable effects a person gets from smoking, along with reducing the symptoms associated with nicotine withdrawal. Several studies have reported that varenicline may even more than double the likelihood of quitting smoking. Some studies have also found that it may be more effective than bupropion, at least in the short term. Reported side effects of varenicline include headaches, nausea, vomiting, sleep problems, unusual dreams, flatulence, gas, and taste changes. Atropamine and scopolamine combination therapy. Some specialized cessation clinics offer an injection-based program of the anticholinergic drugs atropamine and scopolamine to help reduce symptoms by abstaining from smoking. These drugs are more commonly prescribed for other reasons, such as digestive system problems, dizziness, or Parkinson's disease. Treatment usually involves injections given in the clinic within a day, followed by a few weeks with pills and patches placed behind the ear. Other medications may be included to alleviate side effects as well. Possible side effects of this treatment include dizziness, constipation, dry mouth, altered sense of taste and smell, urination problems, and blurred vision. Pregnant women or people with a history of heart problems, glaucoma, or uncontrolled high blood pressure are not allowed to participate in these programs. If you're interested in learning more about clinical hypnosis, watch our next video. Do you gain weight by quitting smoking? Remember to study the description of this video, where you can find a link to free training classes on clinical hypnosis, with several free ebooks as well. If you have questions, ask them in the comments area on this topic and many others we will talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.